Pilates Chicks, and it's season 5, episode 7.
Yep.
Yay, what are we chatting about today?
Today, we are discussing the idea of MRIs and scans with clients.
Yes.
And how clients it's a lot. Clients can come in with some new images that they just got done and maybe some new diagnosis and have a lot of fear around
anxiety.
Yeah, lots of anxiety around these new words that they're told by their physicians, like tear, labrum tear, rupture,
degenerative disc,
slipped disc. Yeah. All these things that sound scary, slipped, torn, these things that...
or the ones where it's multiple things, right?
Oh, yeah.
Like multiple, and they're like, oh my gosh, all this stuff is
They're
wrong.
looking at this whole list of findings from this MRI. And so I think it's important for teachers to be aware of what MRIs mean.
And what they're actually saying.
What they're actually saying.
Because that's the other thing. You and I had a discussion because I had a new client that came to me that sent her MRI from 2005, from, all this stuff. And the way sometimes these MRIs are worded, if you because I'm like, well, that's just this huge word. I don't know what this is. I don't understand this. I don't understand this. And if you just type in, you're like, oh, well, that's just a minor whatever.
Yeah.
It's not, it sounds really scary in a lot of the verbiage.
Yeah, and it's definitely important for clients to talk to their physicians about their MRI.
Yes.
But with my background, sometimes I'll just ask my client to send me their report if they're comfortable with it, so I can see it myself. And so it's not coming just from my client. Yeah. Because I need to see the actual words that are listed. Because
hopefully the imaging.
Yeah.
Sometimes you can get that.
And the report it's super helpful to see it. And again, not everybody is versed in reading an MRI. Of course, it's not really, it's not in the scope of Pilates teachers.
No.
But it can be very helpful to see the information. And like you're saying, for the client, it can sound very scary and very intense, and it's a lot of words, and it's very frightening. But then, a lot of the things you'll read, and it says, no remarkable findings.
Yes.
And my clients are like, why not? I'm like, no, that's good.
That's good. That's a good thing.
No, you're
good
okay.
Thing.
No remarkable
findings. And a lot
findings.
of it is normal, aging.
Yeah.
And there can be no pain. The person has no pain, and then all of a sudden they find out, oh, I've got a herniated disc here, or I've got a and it's but they're not in pain. There's no pain.
Yeah. And so that's the tricky thing with imaging. If there are new or worsening symptoms, then it can be helpful to get imaging done to just kind of see what's going on. But then at the same time, let's say this person has pain in their hip, then they have all of these things that have come out on the MRI, and the majority of them have nothing to do with this person's pain, that they've had these findings, they've had that for a long time. There can be chronic conditions that have no pain associated. There can be people who have had a bulging disc for decades and have no pain. And then somebody might not have a bulging disc and have a lot of pain.
Yep. Yeah. It's like we said, there's no black and white in terms of, and we've talked about this before with pain, is one person's tolerance and another person's tolerance.
Very different.
Very different. And the same thing goes with fear and anxiety. It's some people get that MRI and it freezes them and it starts to define them.
Yes.
And what they can and can't do.
Yeah, because then they're like, okay, well, I have a torn labrum. That's me now.
Yeah, that's me now. This is me. Yeah. Which is not what we want from our clients.
No, it's important. It's important to understand and to know what's going on. Again, if there is sharp pain, sudden onset,
burning,
tingling, radiating, any of those, that is important to check.
Definitely.
And if there's new or worsening, but for the majority of clients, for the majority of cases, movement is beneficial and it's pain relieving. It helps conditions, of course, the right type of movement. And so it is helpful to know what's happening, but it's really helpful to talk to a client about this and say, a majority of people over a certain age will have these findings in an MRI.
Yeah.
Most images you see will have some sort of spinal degeneration, maybe a little bit of stenosis, herniations.
Yeah. Especially when you get into the more commonly into the lumbar.
Yeah.
I mean, that's just the most weight bearing. Makes sense. It happens to, as people age, especially if they've had a lot of impact or whatever. It
is what we tend to see in a majority of MRIs. And like we said, it doesn't necessarily mean the person will have pain just because you have those findings in an MRI. It doesn't mean the person will be limited or have functional limitation or have any change in their life, really.
Right. And then you also have, like, let's say, like we were talking about, where they have a pain and that's why they get the MRI, and it is, a herniated disc and whatever, and it's affecting a nerve, whatever's happening. And that doesn't mean that and I'm just generally speaking, that doesn't mean their whole life is going to be in this pain.
Yeah.
Hopefully with Pilates we can create and get some type of getting, but of course there's going to be flare-ups maybe because maybe it gets, back into that nerve again. But helping the client understand that this isn't the be-all, end-all.
Yeah. That they don't necessarily have to be in pain for the rest of their life.
Yeah.
And they're not defined by this injury or this pathology.
They're not broken.
Yeah. I mean, and then we see that, like, often pain isn't coming from that source of tissue that is degenerated on the MRI.
Yeah, it's not. So, it's not that root cause.
Yeah, and unfortunately, it's not that easy to diagnose just from an MRI.
No.
So and Pilates teachers should never be diagnosing.
No, we never diagnose.
No. So
depending, that is not in our scope of practice.
It's not in scope. But depending on what the physician and PT says that the client's working with, they should definitely be diagnosing something based on the imaging and the functional levels of movement and pain levels. So diagnosis will definitely not be just from the imaging, and that's also helpful for clients to know.
Right. And because it kind of goes into the whole kind of the work of Pilates in terms of that it is to the individual body in front of us. And someone can have the same imaging, meaning the same kind of disc issue at the same point in their body.
Yeah.
But they're going to be moving different. Their tolerance will be different.
Yeah. Pain level
will be different. So there's no fix, this is how we go.
Yeah. Yeah, and there are tests, like there's research done where they show like a bunch of physicians, all these different MRIs.
Yeah.
And you'll see a whole bunch of patients. Let's say all these patients have back pain and all these patients don't, and they just blind study, like give the imaging to the physicians, and they're like, okay, which of these patients have pain? They can't tell just based on the imaging. Because you will have, like you said, you'll have somebody with, let's say, a herniation at the exact same spinal level, for the exact same number of years. One person has no pain and one person is in severe pain.
Severe pain, yeah.
And it just really depends on the individual, which is why we were talking about earlier how pain is just information.
Yep.
Scans are just information. They don't define.
Right. MRIs are just information. Like, for me, when that client sent, the new client, who, by the way, was lovely. I love her. It was fear. I was new to her. She was coming from PT. She was referred by our friend Cindy. And so she just wanted to make sure I knew exactly, well, in her mind, all her limitations.
Yeah. What she thought of as her limitations.
As she thought. And I was like, this is great. Let's get you in the studio and see how we go, how we move. And what she realized, we worked out, and that's the other thing is, you need to help them understand they're not broken.
Yeah.
So she actually worked out. And then she's like, wow, it just felt so good to move again.
Yeah.
because she'd been in PT, which, of course, they're dealing with those issues, and we're not PTs. And so we were moving, but knowing what her, I was going with her and her movement. But we just have to make sure we don't treat them like they are broken.
Right.
And we know what we can and can't do because we obviously have been through all our training. So.
Training, yeah. Yeah. So you know what contraindications there are for certain issues. But yeah, just letting somebody move in a safe and effective manner.
Exactly.
But people can feel so good, like you're saying, just getting back to moving after they've been so hyper-focused on this injury. And now in the post-rehabilitative process, they're like, oh, I'm more than my injury.
Yeah. I can do more than I thought I could. Because that's so freeing.
So much.
And then it opens up that whole, she's like, oh, I could go back to doing this. I could go back, and I'm not talking about like anything weird or off the charts.
Something crazy.
But yeah, because all of a sudden she's like, oh, I can move this way. I can work out. Yeah. So it's, and I can't remember who, I think it was in one of my programs with Kara and Jeremy with MS. And it was talking about that, like you just said, with the Pilates environment, is we're not a PT. So it should be a supportive, safe, moving experience instead of being fixated on what's wrong with them.
Yeah.
And we need to fix this because they're getting that in PT.
Yeah. I mean, and that's why PT work and Pilates work is so integrated and works so well together. Because we're focusing full body and full body integration in a safe way. And then the physical therapy is focusing on that specific acute rehab. Yeah. And it just works together. And so I work side by side with PTs all the time. And so I've had clients come in and they maybe have just left their PT session and then are coming to Pilates. And I say, okay, you just worked all of this for this injury. You did X, Y, and Z.
Blah, blah, blah.
So let's ignore all of that today and, do some upper body, do some full body,
move.
Yeah. No,
in a different
I haven't
way.
done this for so long. And so then, let's say you're doing your knee. And so, okay, let's do some arm work and just be able to do that. And they're like, oh, it feels so good to move.
Yeah. And that's just it. It's like we need to take the information, like you said, and, wipe away all the kind of like, oh, that's normal, whatever. This is this is this. This is an issue. This is an issue. But let the client feel, okay, yes, we see you. We see this.
Yeah.
But we can move forward. Yeah. We're not stuck here.
Yeah. And maybe for an acute phase of an injury,
you deal with that.
You're dealing with that and you're kind of stuck in it. But like helping the client feel supported in the studio. They know we understand their conditions. I looked at your report. I get it. I see it. And
we hear them.
Yeah.
Because it's, there's fear and anxiety and we need to acknowledge that with them.
Totally.
Yeah. To make them feel, again, safer.
To make them feel safer. And I mean, when they feel safer with us, when they start to trust us and the studio and the movement, that just helps them feel better in general. And if you feel you're in a safe space, the body literally does relax, which does actually help healing.
Yes. So it's not all like,
well, you're not guarded. You're not on that like fight flight response.
Yeah.
And you can actually work better when you can kind of like take that down a little bit, calm into the space.
Yeah. And it could be a lot of times it's just getting that in the first few, like after that MRI, is just getting them to like be calm again.
Yeah.
And to kind of get rid of all that.
Yeah. All the fear.
And the gripping and the thought process. I think it's important. And we've all been, I mean, you and I, all of us in this room.
All of us in this room.
All of us in this room have had journeys of pain and having to like kind of talk ourselves into, okay.
Yeah.
Yeah.
And I've thought before when I'm dealing with my own flare-ups of old injuries where I'm like thinking about it from a client's perspective where I'm like, I know all the stuff that goes into this, and I know the, body mechanics and the rehab stuff behind it. But if I didn't, and even knowing it's scary.
Yeah.
And it's frustrating.
Yeah. And that's just it. Because, yours has been, where you couldn't move, right? It's, such pain. So imagine if you didn't know what you do. Because I've had clients I had a client that I got her because they were on vacation and her back went out and it never had before. And she had to crawl to the back. I mean, it was awful. And I obviously didn't get her at that point. She recovered again. But I mean, she thought she would never be able to move again in a normal way.
Yeah, to move fully. Because it can take time. I mean, it really does
and to be out of
time.
Pain.
Yeah. Pain can be lingering, and
it can come back.
Flare-ups happen. And I tell clients that, just because you have, especially in a chronic condition, but also things that are more just kind of one time and done. I mean, you still have flare-ups that can occur, and there's a couple steps back, couple steps forward.
It happens.
It happens.
Just, And I tell them this, too. It's you can maybe have done something with no issue, whatever, before, and then all of a sudden it flares up, and that's out the window. And it's it's okay.
Yeah.
Flare-ups happen.
And it's frustrating. It's scary.
And we need to remember that for our clients. Because I think a lot of, and I probably have said this before, my teacher said, I'm bringing him a lot up in the last 2 sessions. But he talked about, as teachers, with our own injuries, it helps us relate to the clients.
Yeah.
And if we've never been injured, it's really hard because you don't, it sounds, kind of snotty or whatever, but you really don't understand. You think you might, but you really don't. Unless you've been in pain like that where you think, is this it?
Yeah.
Is this my life?
I mean, it's true. Being in that level of limitation and restriction and just severe pain where that's the only thing you can think about. And how do I get through the day with this injury and this pain? Will
it ever end?
Yeah. Will I ever be normal again? Being a practitioner in this field, it is very helpful to have experienced that at some point in some way.
Not that we're wishing that on
No,
people,
I was just thinking that too. But, it is when we do have the frustration of dealing with an injury, it is helpful for us in this work because it does help us understand and empathize and, embody what that means to be going through that. That I think really helps in working with clients.
Yeah. I tell that to my students because some of them have had injuries or get, upset because they can't do something because it will cause pain or whatever. And it's don't look at it as this broken thing that you have, but that your clients are going to go, oh, you understand me.
Yeah.
You understand what I'm talking about.
Yeah, completely. And just because we teach Pilates does not mean we have to be able to do absolutely everything.
Right. Or be perfect
in any of it. And there's certain movements that don't work for certain bodies. And if we have certain movements that don't work for us, then we know that they're not going to work for certain other people. Yeah. And so you understand why somebody is either afraid of something or can't do something.
Exactly.
It's just helpful to understand.
It's it just makes you more empathetic.
It does.
With your clients, and they see that. And I remember someone said to me once, it's when you're, I'll do something, kind of mine, and I'll be okay, well, when my knee was acting up.
Yeah.
And it was I had a new student, and it's okay, double, kick, so my leg wouldn't kick. And it's okay, so right now, you see this knee is not doing this, but then, it's and they're kind of I don't know, it makes you more human as well.
Definitely. Yeah.
And it makes you more relatable in terms of them not feeling so much fear or anxiety.
Yeah. Yeah, even for somebody who doesn't have pain coming into the studio as a new client.
It's overwhelming,
I have to be perfect.
Yeah, it's oh, look at this. Oh, my gosh. And And then, yes, if we sometimes demo something, we've done it like a million times. So they're like, oh, you made that look so easy. But it's like, you're like, no, but.
Like, well, I've practiced it a lot. And other things I can't do. But
I'm just not going to show you them. You don't get to see those.
Nope.
Yeah, but it does make you more aware of when that client comes in that with that MRI. I had one today, which is kind of off, but kind of the same as she came in and she said, oh, I found out I have osteoporosis in my hips, so we got to be careful and not break me.
Yeah.
But this woman does yoga and squat and does all these things, and it's like, I know she's going to keep doing them.
Yeah.
I'm like, oh,
and she should.
And
to
she should
stay
to stay strong.
Yeah.
And I'm like, don't worry, we're not going to break you. And then she was fine.
Yeah.
I was like, I didn't like obsess about it and go, oh my gosh, it's like,
be careful with this.
Be careful with this. I was like, okay, don't worry about it, but it's good information.
Yeah.
Now I have it, which I didn't before because she just had it done. But yeah, it's like we don't want to go, oh my gosh.
Yeah. Definitely, as a practitioner, we do not want to do that because that will then make the client be afraid.
More fearful. Yeah, and even if you don't understand, like maybe you're a new teacher that's not as experienced and haven't dealt with something, it's like still just kind of stay calm. You can always do your research.
Exactly, yeah. And I used to do that as a new teacher. I would just kind of fake it enough to make the client feel comfortable. Be like, okay, that's fine.
Yeah, your precautions and contraindications that you had learned.
You have your own, you know what's likely safe. And then
you go real safe.
Right, yeah, just be safer in that, that first session with that. And then write it down, do some research, and become more comfortable with it. Of course, if there's a condition we're not comfortable teaching, refer out. Yeah. But the idea is to try to make the client feel more comfortable because the majority of findings in an MRI and scans are not where the pain's coming from and a lot of the things are not problematic.
Right. Or it is like normal
degeneration.
Aging.
Yeah.
Crap we have to put up with.
Yup. It's what it is.
Yes. But I feel like it just understanding the anxiety and the fear. I think it's a good idea to ask to see the MRI. I do.
I think so.
I mean, I want the report.
The report, yeah.
Yeah.
I think it's helpful to see the report because most clients don't have a background in anatomy or movement sciences. And so what they're telling you that the physician told them, who knows?
Well, it's like when you go to a doctor and they always tell you to bring someone with you because you hear, it's like, and then you're like, what? And then, of course, when we're getting into a situation like we're talking about, a lot of fear, anxiety immediately comes in when the doctor's talking to you.
Yeah. They're like, oh, we saw this and this and this and this and this.
And then
you
forget everything.
Yeah. And often these days, since everything's electronic, I see my clients get the report first before they talk to their doctor, and then they're freaking out.
Yeah, they're freaking
because they're like, it's so long, and there's all these words, and I don't know what anything means. And I'm like, okay, let me see it. It's okay.
Send it over. We're okay. I just say, like, oh my gosh, and I can't get in for another week. It's like, okay, we're okay.
Or 5 weeks these days.
Oh my gosh, I know.
I'm like, okay.
But we're not diagnosing. We're just telling them what it says.
Yeah. What it already says.
It already says.
Yeah.
But we're not telling them, oh, yeah, I knew that. No.
Yeah.
I still thought that. But anyway, that's kind of our thought process on MRI. And that kind of came to us just, how did that come to us?
Well, because we've had a lot of clients with MRIs who are freaking out.
And we're like, oh, that's a good
anxious.
podcast. Yeah. We're assuming you guys have that as well.
Likely so. And if anybody has questions about looking at MRI reports or your own questions around that and how to deal with it and stay within scope of practice.
Yes, very important.
Let us know. Reach out. And we'll be happy to mentor.
And it's also really important, and we'll just end on this and then get to our sponsor, is to really, when you do your research, when you do Google, is that you're really getting updated scientific information.
Updated.
Because anyone can post anything on the internet.
You're not looking for an opinion piece.
No. Really doing your research that what you're looking at is updated. It is
accurate,
legit, accurate. Because the last thing you want to do is get bad information on that respect.
Yeah,
or
outdated.
Old information that's outdated and not true anymore because they discovered more.
Exactly.
Yeah. And who's our sponsor? Yes, it's us.
We are our sponsor, Two Pilates Chicks, May Workshop, May 18th.
Here in LA, 4 CECs, and you can check it out on our website at PilatesChicks.com.
Or follow us on Instagram at Two Pilates Chicks, and we have more information there.
Or, like you just said, email us. We're happy to send you information. We do kind of have the space limited because we want to make sure everyone gets the most out of it.
Nice, small, intimate group.
Yeah. So just check it out on our website, and you can look at all what it's about and what you're going to learn and explore. And we're super excited.
Yes.
Yay. So thanks for listening. And we'll chat next time.
We'll see you next time.
See you next time. Bye.